Nursing NCLEX RN Review Video, Cultural Sensitivity and Awareness. In this video, I'm going to talk about cultural sensitivity and awareness needed to know for the Nursing NCLEX RN exam. Before I begin, be sure to check out the links in the description box for various free NCLEX content and subscribe as I upload at least one new nursing video every single week. This section, in my opinion, is quite controversial. However, it is backed by evidence-based statistics and are therefore important facts for us as nurses to understand. Each ethnicity is prone to having increased risk of different health comorbidities. However, less controversial are patients' cultural and religious values. This is important for our everyday practice, but also for the NCLEX exam. We need to understand how different cultures may impact the care we provide, whether it is through dietary needs or through medical intervention preferences. These may come up on the NCLEX exam in a scenario and are critical to remember. Again, this is not going to cover everything about their values. Obviously, that would be very long, and instead, we're going to cover the facts needed to know for the NCLEX exam. African Americans have increased risk of sickle cell anemia, hypertension, heart disease, cancer, lactose intolerance, diabetes mellitus, and obesity. Amish people are more likely to be prone to genetic disorders due to cases of intermarriage, rare use of alcohol and tobacco, and are otherwise healthy. Asian Americans are sensitive to touch. You may want to limit eye contact, avoid using hand gestures. Female patients typically prefer female healthcare providers, encourage family involvement in care, and may prefer alternative forms of medicine. Hispanic and Latino Americans are sensitive to touch with children. A healthcare professional must always ask permission to touch a child, as some believe that doing so without permission may cause an evil eye, or in other words, bad luck to come to that child. Before I continue, these videos take a long time to make, and if you would like to see more videos like this, give me feedback by either giving it a thumbs up or a thumbs down. This will help me decide whether I should continue making more videos like this. Thank you. Native Americans require individualized care as there are many variations, and each Native American is at risk for PTSD due to trauma experienced in their past. Patients may avoid eye contact but still be attentive. Encourage items of preference to be brought in by the family. These patients have increased risk of alcohol abuse, obesity, heart disease, diabetes, tuberculosis, arthritis, lactose intolerance, and gallbladder disease. Jehovah's Witnesses are likely to refuse transfusion of blood. Jehovah's Witnesses believe that the soul cannot live after the body has died. Lastly, many of these cultures utilize herbal remedies for many of their chronic issues, and this means that we should familiarize ourselves with them and identify what they do. From my experience writing the exam and doing endless practice questions, here are the most common ones that come up. Garlic, it's an antioxidant used to lower cholesterol levels. Ginger, an antiemetic used for nausea and vomiting. Ginkgo biloba Ginkgo biloba is a blood thinner and antioxidant used to improve memory. Ginseng increases physical endurance and stamina, used for stress and fatigue. Saw palmetto, anti-estrogen activity, used for urinary tract infections and benign prostatic hypertrophy. St. John's wort is an antibacterial, antiviral, and antidepressant. That is going to be the end of this video. Here's how you can visit my website, simplefitnurse.com, for various free content. Thank you for watching, and in my next video, we're going to talk about delegation of tasks.
Hey guys, just thought I would show you how to get to my website. All you got to do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.